Proceed to the next topical in the name of Deputy Michael Fitzmaurice, who is 4 minutes.
And thanks, Minister, for coming in. Minister, over a long number of years, the delivery of incontinence wear is hugely important to people in different parts of this country. In very remote areas where this service has been available by the HSE, and it has been invaluable for the need, and especially for families that are vulnerable or may have a vulnerable person in their house that needs it. Unfortunately, Minister, I think I and other politicians have been made aware of the service required not being as good in the delivery of the incontinence wear to people in different parts of the country. And this is a service that is required to be, you cannot just say I'll come today or some other day. And unfortunately, from what I understand, and you'll be able to confirm that there is, on the satisfaction rate that the likes of the HSE done, it is low at the moment on that. I believe, Minister, and you can confirm this or not, that 2 HSE management people are gone in looking at the situation in the last number of days. And Minister, I think that there has been a sort of a cloud over this for a while, with temporary contracts rolling over and rolling over. In these temporary contracts, my understanding is that there is the HSE, that there is a large amount of money due to a company. I also believe that under the contract, the manufacturer and the supplier weren't to be paid direct, that it was to be to the person that got the contract. And my understanding is that that has all changed now at the moment. And unfortunately, at the end of the day, with all that's going on in this situation, Minister, it appears that the person, the most vulnerable person, the person that needs the incontinence wear, is the person that's losing out on it. Is there, in the HSE at the moment, as I know in some communities, or some people that would ring you up, they don't seem to, they don't know what's going on, and is there a fear in the HSE that there is a problem or a problem that needs to be sorted? I believe that the contract, even though it's a temporary contract, has been changed twice over the last few months, which, you know, is, I don't know how you can do that, but that's what appears to be done to try and solve problems. And I'm wondering, where is the HSE in all of this, or will this situation be sorted out? Because at the end of the day, regardless of, you know, who manufactures a product or who delivers a product, it's the people at the end that needs the product that's of the utmost importance, and people need to make sure that it's delivered on time. My understanding is, Minister, that there was like 18 boxes to be delivered on the contract before that, and this was pointed out that it was wide open for interpretation. And I'm just wondering, where is the HSE in all of this? Is there, is it going to be sorted out? Is it going to be sorted out shortly? Because we've got to make sure that those people in different parts of the country, and as I've said, down through the years, it has been a very good service, that this can be resolved once and for all.
Minister has 4 minutes.
Thank you, Deputy Fitzmaurice. And I'd like to thank you for the opportunity to address the issue here in the House. The community-funded schemes are a collective name for the many product support, supplies, aids and appliances provided through the HSE Community Services for eligible persons. Their main purpose is to assist and support service users to live at home, and also to facilitate hospital avoidance and assist with early discharge from hospital. The products are prescribed by consultants, GPs, public health nurses, continence advisors, physiotherapists, occupational therapists, speech and language therapists and dietitians. The products include incontinence wear, which are delivered to healthcare settings such as long-stay residential services and to persons in their own homes. The HSE is a national contract for the supply of incontinence products. In addition to providing incontinence wear products to healthcare settings such as long-stay residential services, the HSE provides home deliveries to eligible persons in their own homes. Following a tendering process, the HSE selected a new product supplier and a new product distributor in 2018. I understand from the HSE that the new contracts have involved a lot of changes in the range of products and their distribution. There have been some issues in relation to the timely delivery of products under the new contract. In 2018, the HSE put measures in place, including additional staff, an electronic management system and training of drivers to address initial difficulties. The HSE has informed my colleague, the Minister for Health, that it is continuing to work closely with the contracted delivery partners to ensure that the problems experienced by some service users in the Community Healthcare West region and other community healthcare organisation areas are addressed as a matter of priority. A governance structure has been put in place to oversee the national contract for the supply and delivery of incontinence products to ensure the timely delivery of these products to eligible persons across all community healthcare organisations. This involves additional controls and monitoring measures in respect of the ordering and distribution of these products in each community healthcare organisation. To support this process, additional administrative staff have been put in place to carry out this work. The HSE is committed to ensuring that these service improvements will result in an enhanced and more efficient service for all. Margaret, that's concluded.
Thank you, Minister, for your reply. And we know that there's a new contract, but the problem is there was one long-term contract being put out, and this what seems to now. Let us be clear on this, that there was a very good service down through the years. We didn't hear anything, but over the last few months, I think most TDs are getting phone calls. Can you confirm that HSE personnel has been put in to, or in the last few days, to monitor this? Can you confirm that it's the contract that was there, that it was that you paid one person or one company, that now it's split up, that the company that manufactured the product has to be paid direct? Can you confirm that it will be sorted out for those vulnerable people very shortly? And is there going to be a long-term contract, or what's going to be done? Because obviously this short-term contract doesn't appear to be sorting itself out. And is the Minister anyways concerned that if you change a contract twice during it, even though it's a short-term contract, that there may be difficulties down the road? Margaret.
Minister, 2 minutes.
Yeah, thank you. I can't give the Deputy any further detail on the contract or the subdivision that he's referring to of the contract there, but what I can assure the Deputy is that in the first instance that the HSE acknowledges this issue is an issue, and that they have had challenges in the delivery, and as you said, a number of public representatives, as is our obligation to bring these issues on behalf of the people to this House and to other fora to have them addressed. So the HSE, when asked for a response to this, have acknowledged that there has been an issue, and they have outlined the number of issues that they have, or the number of steps they have taken to address it, vis-à-vis the electronic control management and putting additional administrative staff on to try and deal with the logistical issues that have arisen in this. And they have assured me that they're confident that they can manage this and get to resolve the issues that have arisen, and that they, you know, as I say, they want it to be, the service to be of the standard that is expected of the HSE to deliver, and they want the service to be that, and they are working actively towards reaching that goal, and have promised to keep my department informed of progress on it. So I'm quite happy to share that with the Deputy. And if you have any further concerns, again, please feel free to come back as well. I'd be more than happy to take it from you. But at this stage and point in time, I have to take their word that they are doing everything they can do to address it, and I have to give them the opportunity to do so. Okay, thank you.